So I am Delon Brennen. I'm the Deputy Chief Medical Officer at the Ministry of Health in the Bahamas. We knew that there were other coping mechanisms that people would take on, but we don't necessarily know how that's going to manifest itself in our population. So as people came into our individual shelters, or they came into our communities, we started to see new issues that we needed additional help from our regional and international partners on as well. So one of the things that we really didn't give a whole lot of thought to when the storm was going on, but as it started to manifest, was what our sexual and reproductive health needs were going to be. We noticed that, we were having acute issues about lots of people in small settings, in shelters and in communal settings, and just putting people in those settings, you're setting the population up for a new set of dynamics, new people that they're going to see and the like. And we realized that the sexual and reproductive health issues are now coming to the fore. And so, we realized there are new issues related to newly diagnosed sexually transmitted infections, new issues with newly diagnosed pregnancies. We have people who are already pregnant that need additional care and services, but their healthcare provider that they usually went to, that structure may not even exist anymore. That provider may not be available anymore, and we needed to address those needs. And so there were international partners, from both the region and sort of internationally. When you look at it, agencies such as the Pan American Health Organization, UNFPA, that were able to come in and really give us a coordinated approach and really be able to bring in our partners and give them an approach that says, this is what is going on. You've been able to identify what those concerns are, but how do we then begin to address it in the near term, the medium term, and the long term? How do we make sure that those needs are being addressed and we're getting people coordinated and into care? But how do we address the acute issues as well? And as a nation who is built on, some of these principles that we refer to as Christian principles, sometimes the conversation is very difficult to have in our populace. And so when you start talking about sexual health needs and reproductive needs, sometimes it really is pushed under the rug. But in acute situations like this, we don't have that luxury anymore. We have to take it on and address it on the front end. So when you talk about condom distribution, a lot of people will clutch their pearls and hold on and say, why are we doing this and how are we doing this? But you realize, are we willing to, hold on to, well, are we going to talk about this, or are we going to address the needs because we are acutely diagnosing new sexually transmitted infections, new pregnancies, and we can't ignore those facts. We need to make sure that we have a coordinated approach. So what we tried to do was bring in our nationals who know about the system, who know what it is that we've been trying to do, whether it is our sexually transmitted infection clinic providers, whether it is our HIV/AIDS center, whether it is our maternal child health providers, and both in the public sector and the private sector. We want to make sure that everyone who is going to be delivering services, who are local to us, obviously, but also our international partners who are in and delivering services, have a sensitivity to what it is our national protocols are, what our available services are, but also how we need to beef up what we are delivering. But we don't hide the conversation from anyone. We want to make sure it's out in the open. People know it's available. And even if you feel as though you don't need to take advantage of it, it's out there and it's available for you to do so. And there's a confidential way that you can have services delivered. You can talk to a healthcare provider. You can talk to a mental health and psychosocial services provider that no matter how it is that you are coping and dealing with the situation, we can at least make sure you're protected when you do so. So as you start to think about how do I provide food and shelter and other basic necessities, we want you to see this as, let's bring down the walls of stigma and discrimination to go along with it. We want you to feel as though this is a normal part of healthcare. This is a normal part of coping. We want you to be able to address those services as well.